present here and those who joined through online for this inspiring program Visionary Voices Series 3. Visionary Voices. It is a weekly seminar designed to bring influential and forward-thinking speakers to our institute. The aim is to educate and inspire our students by showcasing innovative ideas and transformative perspective. Through this platform, we strive to amplify our vision of establishing Siddha as a global force in its field, fostering a community of leaders and learners who are prepared to make a lasting impact worldwide. I would like to welcome to our esteemed chief guest, Dr. Subbathirai, Assistant Professor, Department of Sensors and Biomedical Technology, School of Electronics Engineering. I cordially invite Professor Dr. Radhika Madhavan, Deputy Medical Superintendent, to welcome and honor our chief guest.
So today I will talk about how you can or why we should integrate modern technology into Siddha systems. I'll focus mainly on nanotechnology and artificial intelligence. Okay. So you can see. Can you identify who this is in this image? Yes, ma'am. So this was generated by AI. Okay. I think I don't need an introduction. We met only a month back, so I will skip this slide and just one new addition. A picture taken during the last meeting, so I'll skip this as well. So we are going to talk about future, right? I think mute பண்ணலன்னு நினைக்கிறேன். மியூட்ல தான் இருக்கு. எக்கோ ஆகுதே. எக்கோ அப்படியா? சரி, once again. Alt tab. Oops. Alt tab. பிடிச்சிட்டே இருக்கணுமா? See little bit from the past and see what we can learn from it. சரியா? So history of Tamil Nadu, Tamil and Siddha. One slide on that, okay? முன்னாடி Homo sapiens, someone like Homo sapiens have lived. We have evidence for that, and the evidence is based on some artifacts, stone artifacts that were collected. And Tamilku vandu we probably know how old and ancient Tamil is, and that's from the Brahmi Tamil alphabets discovered in some caves. And Siddha we claim that Siddha medicine is almost 10,000 years old. So this is the past and little more. அதிலிருந்து இன்னும் கொஞ்சம் பின்னாடி போய் பார்க்கலாம். Big Bang. That's how we all came to existence, right? So what are we made up of? We all are made up of some atoms, different types of atoms, right? Where did the atoms come from? The hypothesis is Big Bang. So Big Bang எப்போ நடந்தது? Almost 30. So 13.8 billion years முன்னாடி, fine. And the year, I mean, like before 13.8 billion years, Big Bang happened. After Big Bang, within a few not few seconds, within a fraction of seconds, I think it's 10 power minus, I think it's 12 or 32. Check it out. Quarks started to form. And 3 lakh years, Big Bang நடந்து 3 lakh years கழிச்சு atoms were formed. And அதுக்கப்புறம் ஒரு 1 billion yearல galaxies were formed. And 13 to 14 billion yearsல the universe, the modern universe was formed. So that is the history. So you all know a lot of metals, right? Can you name a few metals which we use in Siddha? Huh? Yeah. So gold is one of my research material. So we will talk little bit about gold. Gold எப்போ வந்து earthக்கு வந்துச்சுன்னு தெரியுமா? No ma'am, it is on the slide. So gold reached earth
200 million years after the formation of earth. Okay? And 200 million years க்கு முன்னாடி earth எப்படி இருந்துச்சுன்னு ஒரு ஐடியா இருக்கா? இப்பத்துல இருந்து 200 million years க்கு முன்னாடி. So these guys were inhabiting earth. Okay? So இவங்க கிட்ட இருந்து தான் நம்ம evolve ஆகி வந்திருக்கோம். One small question. What is this image and how old is the system? Can you guess what this image is of? இது என்ன image? Image formation. எங்க image formation எங்க? Very good. How old you think your eye or your retina? How old is your retina? Guess. Huh? 5? 9? Yeah, your retinas, but you know the human retina in general, like everything evolved from some point, right? எவ்வளோ நாளைக்கு முன்னாடி ரெட்டினா எவால்வ் ஆச்சு? When did human retina come into existence? So earth is around 4.5 billion years old, and evolution of retina
began from 500 million years ago. That's how old the retina is. Okay? And copper the first metal. Humans use first metal copper, and it started around 10,000 years ago. So this is all the past, and few more slides on the past. So take a look at this. The first image is artifacts again from
4000 BC. Varna gold. So that is the oldest gold ornament humans have discovered so far. Second one வந்து Egypt la irundhu pallu, like it's a tooth prosthesis. Okay, again that is also made of gold. 3000 BC. And the next one is from Incas, South Americans. Incas வந்து நம்ம இங்க தேரையர் சொல்றோம் இல்லையா, அந்த மாதிரி Incas also did a lot of brain related surgeries. ஸோ அவங்க அந்த வார்ஃபேர் எல்லாம் உடையிற மண்டையை வந்து கோல்டு பிளேட்ஸ் வச்சு they will try to set it up. அந்த ப்ராசஸில் கிடைச்ச இந்த ஸ்கல் வந்து it happened, I mean this is from around 500 BC. Okay, and next is the Roman cups with gold and silver nanoparticles, and கீழே வந்து ஒரு காப்பர் pendant from 8700 BC. So this is what humans were doing for the last
thousands of years. Okay, and because we are Siddha people and we use lot of plant related medicines, I have also put a small reference for plant. What is the oldest evidence of plant related medicine? So that is from the Sumerian civilization,
somewhere around 3000 BC. So அவங்க வந்து அந்த like the clay tablets la வந்து they have mentioned the usage of plants. Okay, I think that is it for the history, and this is about the again metal medicines. So எந்தெந்த civilizationsல எப்பப்போ வந்து metal medicines யூஸ் பண்ணாங்க. So when people have used metal medicines, it means that they have worked with metals.
Lot of experiments were done, lot of chemistry happened. So Egyptians, they used gold powders for as internal medicine from around 3000 BC. Chinese, they used again incinerated metal medicines along with herbs, just like
us, around 2500 BC. Greeks tried to make gold elixirs, they wanted to make liquid form of gold, and they did this around 1200 AD. Distillation processes were done. Then Indian medicine, we know around 100 AD was the first evidence of it. And Tibet people, they started using these kind of precious pills from the 15th AD, sorry, 1500 AD, and then homeopathy, they started to pick that up in around 1700 AD. So this is a brief history of chemistry that happened with metals, which we often use in Siddha. So இப்போ வந்து நம்ம கொஞ்சம் பின்னாடி திரும்பி என்னெல்லாம் நடந்துச்சுன்னு ஒரு ரஃப் ஐடியா பார்த்துட்டோம் இல்லையா? ஸோ இனிமேந்து இப்போ ஃப்யூச்சரில் என்ன இருக்குன்னு பார்ப்போம். I'll come back to the slide if we have time, okay? Yeah. So today or for the last 20 years, nanotechnology is taken over medicine, right? What is nanotechnology, anybody? Huh? Sorry? 10 power minus 9. Yeah, very good. So ஒரு பார்ட்டிக்கல் உள்ள சின்னதாகிறதுனால என்ன நடந்துரும்? What would happen? It will okay. So yeah, you are almost right. So let's see what nanotechnology means in medicine, okay? So any particle ஏதாவது ஒரு டைமென்ஷன், 3 டைமென்ஷன் இருக்கு இல்லையா, 0, 1 and 2, okay? ஏதாவது ஒரு டைமென்ஷன் வந்து 100 நானோமீட்டருக்குள்ள இருந்துச்சுன்னா that material is classified as nanomaterial.
So there are a lot of nanomaterials. I have listed a few here. Mesopores, liposomes, dendrimers, solid lipid carriers, polymeric micelles, carbon nanotubes, gold nanoparticles. Maybe we will speak a little bit on gold nanoparticles. So there are plenty of them. Fine. And this nanomedicine, it started, or the idea originated at around 1908. A guy, he thought that nanomedicines வந்து targeted drug delivery option, targeted drug delivery பண்ண முடியும் அப்படிங்கிற ஒரு ஐடியா வந்துச்சு. From there on, people started to work on nanomaterial. What is special about nanomaterial? ஒரு விஷயம் சின்னதாக இருக்கிறதுனால என்ன பெரிய ஒரு டிஃப்ரென்ஸ் கிடைக்க போகுது? எல்லா இடத்துக்கும் போகும். Yes, that is true partly. So one of the main reasons why people are running behind nanomaterials, why nano is so special, is when the particle size reduces. So this is a sphere, this is a microsphere, and the surface area is 400 pi. Okay, this is a nanoparticle of the same and the sphere, microsphere oda adhe diameter la irukra oru area la irukra nanoparticle. Can you see what the surface area is? It's 4 pi into 10 to the power of 5. So what has happened here? More surface area has happened, right? So when the particle size reduces, you get more surface area. Surface area na, I think everybody knows what surface area is. Surface area increase ஆகறனால என்ன advantages இருக்கும் in the medicine context? Absorption நிறைய இருக்கும், அதுவும் எல்லா இடத்துலையும் அப்சர்வ் ஆகும், அதுக்கிட்டையும் எல்லாரும் நல்லா அப்சர்வ் ஆவாங்க, ரைட்? ட்ரக் டெலிவரிலாம் ரொம்ப எஃபிஷியண்ட்டாக பண்ணலாம். யூ கேன் டூ வெரி வெரி ப்ரிசைஸ் கேல்குலேட்டட் ட்ரக் டெலிவரி, ரைட்? ஸோ தோஸ் ஆர் சம் ஆஃப் த வெரி ரைட் அவே நமக்கு தெரியக்கூடிய சில அட்வான்டேஜஸ். நெக்ஸ்ட், சர்ஃபேஸ் டு வால்யூம் ரேஷியோ இன்க்ரீஸ் ஆகுது. தட் இஸ் அ நம்பர் 1 ஃபீச்சர் that nanomaterials give us in medicine, okay? Second, there is something called as quantum confinement. So இது little bit of physics இதில் இருக்கும், but I'll try to ரொம்ப சிம்பிளாக உங்களுக்கு I'll try to convey what this quantum confinement is.
All of you remember valency band, conduction band and all that, right? Semiconductors, metals, non-metals and all that. So this is the energy band, and இங்கே conduction band மேலே valency band கீழே, okay? And you see that இங்கே சில ஸ்பியர்ஸ் இருக்கு இல்லையா, 6 நானோமீட்டரில் ஸ்டார்ட் ஆகி 2 நானோமீட்டரில் முடிகிற மாதிரி ஸ்பியர்ஸ் இருக்குது. What do you think is happening here? Just focus on the band gap, the gap between the conduction band and the valency band. What is happening? As the particle size is reducing, what is happening to the band gap? It's increasing, right? It means what will be the wavelength of this particle? Band gap increase ஆச்சுனா என்ன கலர் அது கொடுக்கும்? So you can see again, this is color coded. Band gap கம்மியா இருக்கும்போது it is in red color, and as the band gap increases, more energy is needed to jump, right? So you will be getting a blue color, okay? So this is common for any material that you take. இப்போ நீங்கள் ஒரு கோல்டு நானோ பார்ட்டிக்கல் எடுத்துக்கிறீங்கன்னு வச்சுக்கோங்க, say for example, அது வந்து 6 நானோமீட்டர் டயமீட்டரில் இருக்குன்னா அதோட எமிஷன் ஸ்பெக்ட்ரம் வந்து it will be what color it will be? கோல்ட் நானோ பார்ட்டிகல் 6 நானோமீட்டர் இருக்கு, ஒரு 4 நானோமீட்டர் இருக்கு, 2 கோல்ட் நானோ பார்ட்டிகல் உங்ககிட்ட கொடுக்குறோம். அந்த கோல்ட் நானோ பார்ட்டிகல் என்ன கலரில் இருக்கும் பார்க்கறதுக்கு? இந்த மாதிரி சொல்யூஷன் பண்ணிட்டோம். ஸோ எந்த கலர் வந்து 6 நானோமீட்டர் சைஸில் இருக்கும், எந்த கலர் வந்து ப்ளூ ஐ மீன் 2 நானோமீட்டர் சைஸில் இருக்கும்? யா. ஸோ இந்த ஒரு ஃபீச்சர்
வச்சுட்டு என்ன பண்ணலாம் மெடிசனில்? யூ திங்க் அபவுட் இட். ஓகே, இந்த ஒரு ப்ராப்பர்ட்டி, இந்த ஒரு மெட்டீரியல் ப்ராப்பர்ட்டி வச்சுட்டு வாட் வி கேன் டூ இன் மெடிசன், திங்க் அபவுட் இட். ஓகே, and try to relate with all the parpums and chendurams where we have plenty of nanoparticles. Okay, so for medical people you just need to know two things. Nanomaterials will have more surface area and there is something called quantum confinement. So அதை வச்சு தான் எல்லா அப்ளிகேஷனுமே இருக்குது. either with the surface area increase or both these properties will be used for any medical application. So here I have listed a few medical applications that nanotechnology is into. So nano robots வச்சு surgery பண்ணலாம், drug delivery பண்ணலாம், bone tissue engineering, any tissue engineering for that case, implants, nano implants, diagnosis, the quantum confinement property and the color property வச்சுட்டு நம்ம நிறைய diagnosis பண்ணலாம். MRI எல்லாம் பண்ணுறாங்க இல்லையா? So quantum dots are used for scanning and imaging. Okay, then detection. So one of my PhD work was on detection and we have used quantum dots to make some proteins fluorescent. So அந்த மாதிரியும் பண்ணலாம். Then biomarker mapping, same thing. You can mark proteins, ஒரு குறிப்பிட்ட ப்ரோட்டீனை வந்துட்டு கரெக்டாக இமேஜ் பண்ணலாம். அதுக்கெல்லாம் வந்து நானோ மெட்டீரியல் யூஸ் ஆகும். Again, targeted drug delivery. So targeted drug delivery, nanomaterials are the best choice. Then see and treat, therasonic, அதுக்கும் யூஸ் பண்ணலாம். Drug screening and gene delivery. For all this, nanomaterials are used. Fine. So this is a list of maybe important applications of nanomaterials in the field of medicine. Okay.
So one case study, how size matters. And the nanoparticle or nanomaterial oda and the importance kaga I'm just giving this study as an example. So this was done in 2012 and published in 2012. So it was a cancer study. So what they have done is they have used nano diamonds. They have not used any metal. They have used nano diamonds for the study. And this part is
like they have used this doxorubicin. Doxorubicin is a cancer drug, and they have. I think this was done on rat. I think, I'm not sure. So on the
drug வந்து நம்ம ஃப்ரீயா பல்கா நம்ம வந்து அந்த
அனிமலுக்கு கொடுக்கும்போது என்ன ஆகுதுன்னா, it enters the cell through this ABC channel here and through passive diffusion. So இது வந்து outside cell area, இது வந்து inside, the dark blue is the inside cell area. So it is entering. அதே மெடிசனை நீங்கள் வந்து நானோ டைமண்டில் லோட் பண்ணி கொடுக்குறீங்கன்னா, it is entering the cell and you can see that more drug and controlled entry of the drug happens. So here in this panel B, you can see these are the tumor size. So in the first two tumors வந்து நானோ டைமண்டோட அந்த கேன்சர் ட்ரக்கை சேர்த்து கொடுத்தப்போ இருந்த ஒரு டியூமர் சைஸ். அண்ட்
the second two are the pure, like the bare drug, only without any nano diamonds. So it means that more drug is being, or a therapeutic has been created in the cancer cells, and you have a targeted. Okay, so this is one simple example I can tell you of what
nanoparticles. ஸோ உங்களுக்கு வந்து இங்கே என்ன புரிஞ்சிருக்கணும்னா, நானோ டைமண்டை வந்து கேன்சர் ட்ரக்கோட ஃபங்க்ஷனலைஸ் அதை அட்டாச் பண்ணியிருக்காங்க. ஸோ அந்த மாதிரி பல விஷயங்களோட
பல மெடிசன்ஸோட அட்டாச் பண்ணி நம்ம எங்கே டெலிவர் பண்ணணுமோ அந்த மாதிரி நம்ம அதுக்கேற்ற ஒரு ஃபார்முலேஷன் பண்ணி டெலிவர் பண்ணிக்கலாம். ஸோ திஸ் இஸ் a very good example to show how nano materials can enhance therapy. So in வந்து they have used plain, அதாவது bare nano diamonds. அதுலேயும் வந்து அந்த கேன்சர் செல்லோட மைக்ரேஷன் வந்து it has slowed down the cancer cell migration. So even without drug, they have demonstrated that it can affect or it can damage the cancer cell. Okay. So next example is, yeah, this is my favorite. So you all know stem cells, right? I think last time we discussed briefly about stem cells. So stem cells, they are almost totipotent or let's say pluripotent. Fine. And in the images, they are like surface modification. So this is a cover glass.
Sorry.
PLA layers. Like just assume that is some layer. And this stem cells, they are growing stem cells. Can you see what has happened here? This is plain and smooth. Here you have some pillars. And the pillar diameter is 100 nanometer. Here the pillar diameter is 200 nanometer. Here 300 nanometer. Okay? Can you spot what has happened? Can you tell me what is happening here? All surface cells, stem cells. But what has happened? The stem cells have differentiated into different kinds of cells, right? So in 100...
Swallow it. Have you thought about it? So that is also one. You want me to stop? Okay. So first, and the particle on the body enter panni body
fluids or any body fluid contact on the odana. Drug
incompatibilities என்னன்னு பார்க்குறாங்க. அதுக்கப்புறம் ஒரு network of pharmacology is developed out of it. Then herbal chemical components they are using for diagnosis. Then they are also using it for predicting their pharmacokinetic activities. So all this has happened and you will find plenty of publications on all the topics that I have listed right now. Okay, so just go through it and you will get a lot of ideas that can inspire you.
Next is our friends, Ayurvedic friends. What are they doing with AI? So they have also started using AI and they are applying it for diagnosis, prediction and all that. So in the Prakriti determined pandradhukku already a paper is published, and diagnostics to pulse-based diagnosis they have published, and some personalized treatment they have published, and herbal interactions, that is the docking studies and how to predict which is the best molecule, that has also happened. So these are some of the stuffs happened in Ayurveda, and these are some, I have not listed all the papers,
but these are some of the papers published from Ayurvedic people. So you can see that the first publication has happened in 2012.
So they have made a Prakriti analyzing tool. Check this out. And I think next one is for some diagnosis and nature of the human body ku or tool pannirukanga, automatic machine learning approach use panni. Then COVID time they have published one paper for COVID, and medicinal herbs database and tools to how to, this is I think a review paper. Yeah, it's a review paper. So these are the important publications that I pick out from Ayurveda. So go through them. And now I'll just give you a rough like little bit of consultation on what AI has done so far in medical field. So AI வந்து image processing ku தான் main நாங்க யூஸ் பண்ணுவோம். Like there are a lot of any AI or any
biomedical student, they'll be doing project mostly on, they'll take the images, MRI, X-ray images, அதெல்லாம் எடுத்து ஓகே இந்த மாதிரி ஸ்ட்ரக்சரோ இந்த மாதிரி ஒரு பேட்டர்னோ இருந்துச்சுன்னா அது இந்த டிசீஸாக இருக்கும். கோவிட் டைமில் யூ மைட் ஹவ்
seen lot of apps coming up with that came up for diagnosing using making diagnosis based on lung X-rays. If you can try to go read them. Again for
imaging process அது யூஸ் பண்ணலாம். AI in surgery, robotic surgeries involve a lot of artificial intelligence and machine learning. And personalized medicine, okay, in the gender ku, in the genotype ku, in the phenotype ku, in the mariana or condition la, like hundreds and hundreds of data can be collected, and that
can be used to guess or predict which will be the best medicine for that person. So that is personalized medicine, and AI can be used for that. You cannot remember 100 things, right? How many things do you all know the phone numbers of your parents, your friends?
I know only one phone number.
So that is how we are now, right? So can
You remember everything about each person, everything about the case? ஒரு மாசம் முன்னாடி பேசின பேஷண்ட் கூட பேசினதை we would have of course made a note of it, but you know it's difficult, right? So you can use AI for, you can take help from AI here. So personalized medicines we can, I mean already AI is playing a huge role
there. And drug discovery, like I said, ஒரு 550,000 molecules கூட screen
பண்ணி நீங்கள் ஒரு 10 molecules finalize பண்ணலாம் using AI. And disease prediction, again like I said, you can take so much of data about a person, history, family history, their genotype, whatever available, you can use that to make your decisions. And again medical diagnosis, not just imaging, ECG signal வச்சு ECGயும் EEGயும் ஸ்பீச்சும் கம்பைன் பண்ணி நீங்கள் வந்து ஒரு அல்சைமஸ் டயக்னோசிஸ் பண்ணலாம், ஆட்டிசம் பண்ணலாம், அவங்க ஜீனோடைப் வச்சு பண்ணலாம். யூ கேன் ப்ரெடிக்ட் இந்த மாதிரி ஜீனோடைப் இருந்தால், இந்த மாதிரி ஜீன் சீக்வன்சிங் இருந்தால் இவங்களுக்கு இந்த பர்டிகுலர் இயரில் இந்த பர்டிகுலர் டிசீஸ் வரதுக்கான வாய்ப்புகள் இருக்குங்கிற ப்ரிடிக்ஷன்ஸ் எல்லாமே இட் இஸ் ஹேப்பனிங். லாட் ஆஃப் பப்ளிகேஷன்ஸ் ஹவ் ஹேப்பன்ட், ஸோ ஜஸ்ட் செக் தம் அவுட். ஸோ மெடிக்கல் டயக்னோசிஸ், AI is going to play a big role in medical diagnosis. I think many of you have already realized that, and many projects you guys have starting to do now. So it's good. All the best for that. Yes. So finally, mental health.
I don't know why I made one slide for this. Anyway, so AI is already playing a very important role in people's mental health. So AI apps irukku, humanoids irukku, you know, you cannot do counseling for 10,000 or 20,000 people. Like especially in a country like India, we are already in short of physicians and medical people, right? So you can train a software, you can create a virtual counselor or a psychiatrist, and lot of things can be done through it. So ஒரு mass approach பண்ணனும் அப்படினா AI can be a very good tool, but will it have a human touch? No. So that is a big problem with AI. Whatever be it, maybe it can tell you the best. நீங்கள் ஒரு பெரிய ஒரு புக் நிறைய ஒரு ஈக்குவேஷன் போட்டு அதுக்கு ஆன்சர்
கேட்டால் கூட AI சொல்லிடும். But still AI can never replace human beings. AI can never have that, I don't know, I shouldn't say never, but at least for now AI does not have the emotions, and people are working on it. People are working on it, and maybe they will achieve it, who knows. But as of now, that human touch, the human consciousness is only missing in AI. Apart from that, AI is maybe better than us. AI will not judge you, AI will not discriminate you. I mean, if you program it properly, AI won't have any bias. Okay, just imagine there is no bias, nobody is going to, the system will not judge you. How good that would be. So already this is all already happening, but again, how good you program it, how good you create the algorithms, that is all matters. Okay,
so if how many of you want to go learn AI or do something with AI? Nobody. This slide. So I asked AI, I mean ChatGPT, like what should a person read for them to become an artificial intelligent person? So of course it involves a lot of mathematics, especially statistics and probability, linear algebra. These three things are basic, and you have to know a little bit of how you will manage your data set, how to create and manage the data set, and then little bit of that neural networking, and at least one programming language. I would recommend Python. Maybe these days many of my students also use Python. So Python is actually easy to learn. If you put in 1 to 3 months, you can get a certification in Python. So give that a shot, because future is going to be Python. You will probably have a lot of AI around you, and for you to communicate with AI, you need a language, right? So that language is, one of the languages, Python. And then
before we use anything new, we have to know which is right and wrong, right? So we need to know how we can ethically use AI for, especially in medical field. Data security irukku, lot of things are there. So you have to know, just get yourself familiarized a bit with the ethics that you have to know before you use AI. And then privacy stuffs and language processing, computer vision.
So camera related other image data எல்லாத்துக்குமே you should know, have some basic understanding. And the digitalization எப்படி
ஆகுது, அந்த digitalized dataலேருந்து நீங்கள் வந்து அந்த feature extraction எப்படி பண்ணுவீங்க, அந்த feature extraction வச்சு நீங்கள் மாடல் எப்படி create பண்ணுவீங்க, little bit of basics. If you put in 1 year or 2 year, you can become a person who can create your own artificial intelligence. Okay, I mean, it's people are doing, right? So anybody can do that. And these are some things that Siddha people
can do. I'm not going to read everything out for you. We have time, so maybe you can take a pic and just go through it. The next slide also I listed out some applications that we can do using AI in Siddha. So just check out what blockchain is. I told you feature extraction. Maybe I explained what feature extraction is. Go and check out what blockchain means. இது ரெண்டு தெரிஞ்சிக்கிட்டீங்கன்னா உங்களுக்கு வந்து like you will start to understand AI. Yeah. So I'll finish my talk with this quote. So in 1809, Darwin told us, "It is not the strongest of the species that will survive, nor the most intelligent, but the one most responsive to change." So if you are going to change according to your environment, you will survive. Right? So the future is going to be nano, AI. So make applications or get those systems into Siddha system. Okay? Yeah. So Nano and AI can definitely revolutionize Siddha system, and we should always have a balance. This image also is created by AI. I told like create an image with tradition and modern concepts together. So it made me this image, which is nice. So you have to balance. நம்மளோட கான்செப்ட்ஸை என்றைக்கும்
காம்ப்ரமைஸ் பண்ணிக்கக்கூடாது, பட் யூஸ் டெக்னாலஜி டு என்ஹான்ஸ் இட் டு அவர் கரண்ட் நீட்ஸ். And probably people have presented about apps, wellness apps already. It is on the pipeline, I think. And global demand for holistic
healing. So that is the final goal, right? What is the final goal? Our final goal is it
to protect and save Siddha. What is our final goal? What? To give best treatment to the patients, right? Yeah. So that is the goal, and we will all work towards it.
Application that I did as well. So any questions? If you don't ask me questions, I will ask questions to you guys. Okay, tell me one idea that came to your mind when we were discussing about Nano and AI. You can also make images like this. Yeah, tell me. Anybody got any new ideas? What is the takeaway
that you guys got from this talk?
Ma'am, that AI based Siddha slide.
Oh, this one, huh?
Yes, ma'am.
Okay. Oh, you want me to discuss it?
Yes, ma'am.
Good. Smart boy. Smart doctor.
Okay. So
I think the first one, maybe we have an idea. So herbal formulations நிறைய இருக்கு. நம்ம இப்போதைக்கு மெயினாக அந்த பைப்பரின் டர்மரிக்
அந்த மாதிரியான ஒரு 50 மெடிசினல் பிளான்ட்ஸில் தான் மேஜர் ஆஃப் தெம் ஆர் ஒர்க்கிங். ஸோ we can actually explore more, we can discover more phytochemicals or biomolecules. So அதுக்கு வந்து நம்ம A based இது யூஸ் பண்ணலாம். And எந்த phytochemical எந்த genome affect ஆகும், எந்த phenotype affect ஆகும்ன்ற வரைக்கும் we can do predictions. So we can do that. And AI driven lifestyle. So we know, no?
Like morning we have to wear vada pitta kabam, in the like vada degi
இப்படி இருக்கணும், கபதேகி இப்படி இருக்கணும், நிறைய இன்ஸ்ட்ரக்ஷன்ஸ்லாம் இருக்கு இல்லையா, அதெல்லாம் வச்சு ஒரு ஆப் போட்டுட்டு வாததேகி இத்தனை மணிக்கு எந்திரிச்சு இதை பண்ணணும், இதை சாப்பிடணும், that is also possible. And this one, so skin diseasesலாம் நிறைய டிஸ்கிரைப் பண்ணியிருப்பாங்க சித்தால.
ஸோ அதெல்லாம் வச்சு நம்ம கூட we can make one tool. ஸோ அதை ஒரு ஃபோட்டோ எடுத்துட்டா எந்த டிசீஸ், ஸ்கின் டிசீஸ் அப்படின்னு, there are apps. Actually there are probably
apps already there. So you can develop your own app based on Siddha classification for skin diseases. So that is one thing. And
prognosis, disease progress எப்படி இருக்கு, ட்ரீட்மெண்ட்டோட தெரபெட்டிக் எஃபெக்ட் எப்படி இருக்குங்கிறதெல்லாம் கூட அசஸ் பண்ணிக்கலாம். And then virtual consultancy and chatbots. Like
telemedicine, the next step or the next phase of telemedicine is chatbots. So somebody is having some certain like 4 or 5 symptoms, they can just tell it to a bot, and that bot will, okay, you probably have some vada disease, I will send you to the vada doctor. I'm just kidding, like maybe or
neurological disease அப்படினு, if that is the conclusion, maybe it will send you to the neuro department. If it is an eye disease, it's
going to send you to the eye department. So such ஒரு person வந்து அந்த ஸ்க்ரீனிங் பண்ணி அனுப்புறதுக்கு முன்னாடி the bot can do that for us. Then big data, so
patient data is very 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 important. So India ஒரு important problem for AI related projects என்னன்னா, India does not have data access to, we researchers do not have access to the data sets. இப்போ எனக்கு ஒருத்தரோட ஒரு இந்தியனோட பிரெயின் இமேஜ் வேணும், ஒரு 10,000 பிரெயின் இமேஜ் வேணும் அப்படின்னா ஐ டோன்ட் ஹேவ். எனக்கு இந்தியன்ஸோட லங் எக்ஸ்ரே, செஸ்ட் எக்ஸ்ரே வேணும், access not there. So in my university, when we are working on image processing or any AI data application, we take the non-Indian data set and work on it. Will it be, I mean, I won't say it's completely useless, but can it be applied to Indian phenotypes? No. So you guys generate as much data set as possible. நீங்க எல்லாத்தையுமே digitalize பண்ணீங்கன்னு வெச்சுங்க, n வகை தேர்வை digitalize பண்ணீங்கன்னா, like any examination, if you digitalize it, then AI can come in. And like for AI to come in, you have to first digitalize things. Okay? And treatment plans identify பண்றதுக்கு, and cross disciplinary research, I think you can compare disease classification இன்னொரு வாட்டி பண்ணலாம் using AI, so that is possible. And pattern recognitions for diagnosis. Okay, இந்த பர்சனுக்கு ஒரு புது டிசீஸ் வருது, it is not classified, new disease come, right? COVID happened, many things might happen. So இந்த டிசீஸ் இந்த பேட்டர்ன் இருந்துச்சு, ஸோ இந்த டிசீஸ் இதுவாக தான் இருக்கும் அப்படிங்கிற ஒரு ப்ரெடிக்ஷன் பண்ணுறதுக்கு யூஸ் பண்ணிக்கலாம். அண்ட் சித்தா டேட்டாபேஸ், சே ஃபார் எக்ஸாம்பிள் ஒரு பர்டிகுலர் சிம்டம் வந்து ஒரு 200 புக்ஸில் எப்படி கொடுத்துருக்குங்கிற ஒரு நிமிஷத்தில் நம்ம வந்து ரிசோர்ஸ் பண்ணிக்கிறதுக்கு we can use that. And medicine recommendation, okay, this person is having this kind of body, this is the body type of that person, this is the age of that person, this is the gender of this person, this is the work style, this is the temperature and the geographical condition that person lives in, so this
drug might be the best choice. So those predictions can be made. And இப்போ வந்து இவங்களுக்கு வந்து இந்த வயசில் டயபெட்டிஸ் வந்திருக்கு, இன்னும் 10 வருஷம் இந்த மாதிரியான காம்ப்ளிகேஷன்ஸ் வர வாய்ப்பு, அதை நம்ம இப்போதுலேருந்தே இப்படி அட்ரெஸ் பண்ணுறது. இவங்களுக்கு டயபெட்டிஸ் இருக்குன்னா இவங்களுக்கு கேன்சர் வர்றதுக்கான ப்ராபபிலிட்டி இவ்வளோ இருக்குது, வந்து இப்போவே அட்ரெஸ் பண்ணுறது. such diagnosis and such predictions can be made. நான் சொல்கிறதெல்லாம் ஆல்ரெடி மாடர்ன் சைடில் பண்ணிட்டாங்க, do that. And again, identification of repeated of Siddha medicine formula. So many metal preparations, right? So many preparations. Have you ever been confused as which should be the choice? Which method is the best preparation method, or which adjuvant is the best for patient. Have we done that? And can we do that? So that done using AI. இதை ஒரு தடவை பண்ணிட்டா like we can use it for ages. And now is the AI period, like AI era is happening now. We get a lot of fundings for AI related projects. So this is the best time to forward. And pulse rate, pulse rate measurement, body temperature. So ஒருத்தருக்கு வந்து say for example like சந்திரகலை சூரியகலை ரைட். ஸோ அந்த பேட்டர்ன் எப்படி ஒரு நாள் ஃபுல்லாக இருக்குதுன்றது வந்து ஒரு 500 பேருக்கு தெரிஞ்சால் எப்படி இருக்கும்? தட் பி பியூட்டிஃபுல் டேட்டா ரைட். ஸோ மச் ஆஃப் மேல்ஸ்க்கு எப்படி இருக்குது, ஃபீமேல்ஸ்க்கு 24 ஹவர்ஸ்க்கு ஒரு வருஷம் ஃபுல்லாக எப்படி இருக்குங்கிற டேட்டா நம்ம so many things we can confirm, right? We can go back, oh this is what they have told. இந்த சேஞ்ச் நடக்கும்போது மாறும்போது பாடியில் இசிஜி எப்படி இருக்குது, அவங்களோட பாடி டெம்பரேச்சர் எப்படி இருக்குது, no? So many things we can confer from that. So some things like that can also be tried out. And sleep pattern. So already it is phone on the sleep biorhythm apps are already there. And we can also correlate Siddha principles to that. Then blockchain, that is a homework. So I will skip this part. Then IoT na Internet
of Things. So Internet vanda piragu how AI has boomed. So read a little bit on that. So நீங்கள் வந்து உங்கள் கார்டனை வந்து if you set up a herbal garden,
you can monitor it using machine learning tools. You can just control it from anywhere and everywhere. Then wearables, now you know can be measured using just a phone or a app. Brain waves-லாம் apps இருக்கு, you probably know. ஸோ மெடிடேஷன் பண்ணும்போது நீங்கள் எந்த ஹவு தட் சேஞ்சஸ் ஹேப்பன், நீங்கள் தூங்கும் போது என்னென்ன பேட்டர்ன், எப்போ எந்த ஸ்லீப் பேட்டர்னில் இருக்கீங்கிற கண்டுபிடிக்கிறதுக்கெலாம் நிறைய ஆப்ஸ் ஆர் ஆல்ரெடி தேர். ஜஸ்ட் யூ கேன் யூஸ் இட் ஆன் யுவர் ஃபோன். தென் யூஸிங் ரோபோட்ஸ் ஃபார் மேபி இட்ஸ் ஆல்ரெடி ஹேப்பன். அண்ட் தெரப்பிக்கும் ஏஐ யூஸ் பண்ணால் எப்படி இருக்கும்? ஐ டோன்ட் நோ ஹவு தட்
will be, maybe no, but that is also one idea. And இப்போ வந்து the 3D printing,
3D tissue printing is one of the booming areas. So you can incorporate plant medicines to them and explore how things happen. And drug patches, insulin patches வந்துச்சு, nicotine patches இருக்கு, நிறைய hormonal patches are happening. So we can also make some nano formulation and make patches out of it. And for formulating that you will need AI. And again, ethical concerns, AI replacing traditional practitioners, data privacy, and preservation of indigenous knowledge. So that will
actually happen, but I don't think we have to worry about our jobs, so that should be fine. இன்னொரு ஸ்லைடு பண்ணணுமா? I think it's done, no? This one I did. It's completed. Oh, good.
So one question is over. You have a question? Yeah.
Ma'am, we have discussed here a lot of high level things, but the most basic problem arising with us is initiating anything. So my question is, what is the roadmap or a plan of action? If anyone wants to work on nanoparticles, then what are the initial steps to be followed with the available resources?
So first you have to collaborate with me.
For like first identify what material you want to work on.
Okay, once you identify it, characterization can be done anywhere, any university. There are so many universities in Chennai, there are so many universities in Tamil Nadu, so you can characterize it. Adukaprom you will probably have to do a cell line work to check how it is acting on the cell, and then make a data from it and go for further studies. So first thing, you have to either synthesize a nanoparticle or identify a nanoparticle. One place where you can identify a nanoparticle is the metal preparations. Any metal preparation will have a certain percentage of nanoparticles in it. So you can, if you are interested, you can start right away with that. What was the next question?
Second part. You want me to tell for what we have to do for AI also? Okay, that is sorted. Yeah. Thank you.
Thank you so much, ma'am.
No more questions. We wind up.
Both. So in the future, you have to do both. So do research always. What is research? What is the first step of research? Huh? Yeah, questioning something. What is the first step for artificial intelligence? Huh? No. Yeah, okay. For a machine learning to happen, what do you need? What? What do you need? Data. So generate data, digitalize your data. If you do that,
you are taking the 0th step towards artificial intelligence or research or development, everything. So collect and sort data. You should know how to collect data. So how you collect useful data. So just taking some data won't be useful, right? நீங்க பேப்பர்ல எழுதி வைக்கிற டேட்டா நல்லா இருக்குமா இல்ல எக்ஸல் ஷீட் போட்டு அதுல என்டர் பண்ற டேட்டா எக்ஸல். So there is many more apps and softwares for collecting data. So whatever you do digitalize it
from day one.
So if you digitalize it, நீங்க ஒரு 4 or 5 years கழிச்சு கூட you can use the data for something. Maybe உங்களுக்கு இப்போ அதுக்கான ஐடியா தோணிருக்காதா இருக்கும், but you might need it at some point, right? So just to start, collect data, digitalize them. Fine. So that is also the first step for research. You need something to work. So always, yesterday we have digitalized the top, right? Now the last, we would have just exchanged words and that would have been gone, right? So now we can always go back to and refer to what we discussed. You can check if I am having Alzheimer's or not. You can process the voice. Now we have digitalized it. So what is the power of digitalization? We know practically, right? So first digitalize as much as possible. Okay? What are the biosignals you will have to digitalize in Siddha? சித்தால என்னென்னலாம் வந்து ஒரு டயக்னோசிஸ்க்காக டிஜிட்டலைஸ் பண்ணணும். நெய்க்குறி, என்வகை தேர்வு, body temperature. Yeah, so you can start with digitalizing என்வகை தேர்வு. It's not a very difficult thing. One Excel sheet is going to make that happen, right? Whatever case you get, if you just put it, maybe you have an app, right? You already have an app for that in NIS. Is it? Yeah. I'll take one more question. You can ask me about anything. Sorry? Nanomedicine and AI together. Yeah. Because my master's is nanoscience and another master is going to be artificial intelligence. So I work on these two topics. That's why. And that is also going to be the future. And you get a lot of fundings if your project has AI feature in it and nanomaterials in it. AI is come. So we are waiting for you.
Present memento.
Students to the awareness campaign today. As a part of nation's commitment in eliminating tuberculosis in India, the government of India has recently launched a 100-day intensified campaign on TB elimination, which started on 7th December 2024. This nationwide initiative is a significant part of Government of India's commitment to improve public health by eliminating tuberculosis, resulting in reduction in mortality rates. The campaign aims to increase case detection, reduce TB deaths, and to prevent new cases. To achieve these goals, display of information on IEC materials regarding TB eliminations were circulated in organization and public places. On account of these series of events, National Institute of Sidhha has organized a short seminar on tuberculosis today. In this seminar, TB will be explained in detail to all by our PG scholars. I will explain the content of seminar in a gist. The epidemiology and etiology of tuberculosis will be explained by Dr. Shanmugeshwari, Department of Kurunai Maruthuvam. The pathogenesis and physiology of tuberculosis will be covered by Dr. Vasuki, Department of Noinadal. The clinical feature and diagnosis will be explained by Dr. Karunya, Department of Kurunai Maruthuvam. The complications and treatment will be covered by Dr. Tamil Bharati, Department of Nanju Maruthuvam, and the prevention and health programs will be covered by Dr. Vijayalakshmi, Department of Nanju Maruthuvam. With that note, I now call upon Dr. Shanmugeshwari, second year PG scholar, to begin the session.
Tuberculosis is an infectious disease caused by bacteria called myco. People with TB cough, sneeze or spit. Tuberculosis is preventable and curable one. About quarter of global population is estimated to have infected with TB. About 5 to 10% of people infected with TB will get symptoms and develop the disease. World Health Organization ambitiously established a goal of 90% reduction in incidence between 2015 and 2035. TB was the world's most prevalent disease before COVID-2 pandemic. %90 of people infected with TB will tend to develop latent infection. Then 5% of people infected with TB will develop the active disease within first 2 years after the infection. Then about 10.6 million people globally are currently living with active TB, out of which 5.8 million are men, 3.5 million are women, and 1.3 million are children. Geographically, out of the 6 high-burden countries from Southeast Asia region, India accounts for 28% of the global TB burden. According to National TB Prevalence Survey 2021, the crude prevalence of TB infection among individuals above 15 years was 31.3%. And the global burden of disease analysis estimated the number of incident cases to be 3 million people in 2016. A data from National Family Health Survey estimates that incidence of TB in India is about 1,03,404. India's National Strategic Plan 2017 to 2025 aims to achieve a TB-free India. On account of this, now we are conducting a 100 days TB elimination program. These are the death reports about the TB. Comparatively, on 2020 and 2021, the death will decrease from 1.4 million to 1.3 million in 2022. And these are all the death reports about the various regions across 28 states. Now we will discuss about etiology of tuberculosis. The types of tuberculosis are
Mycobacterium tuberculosis will cause pulmonary tuberculosis. Mycobacterium
avian in birds causes avian tuberculosis. In cattle, Mycobacterium bovis causes bovine tuberculosis. Disseminated or miliary tuberculosis that invades the bloodstream and spread to all organs of the body. Mycobacterium africanum, Mycobacterium caniti, and microti. Mode of transmission. Primary mode of transmission is the respiratory route. Other less common routes of transmissions include ingestion of contaminated food or milk in case of bovine TB, transmission from mother to child during childbirth or through breastfeeding, transmission through organ transplantation or blood transfusion from infected donor. Individuals with latent tuberculosis infection do not have active TB and are not highly contagious, but they are at risk of developing TB when they are immunocompromised with some infections such as HIV, AIDS, etc. This is the mode of transmission. TB spreads from droplet infection from infected person to another person. Host factors such as it affects all age groups. It's more prevalent in male than in females. Malnutrition is the predisposing factor to tuberculosis and it's not a hereditary disease. Social factors including smoking, alcohol consumption, poor quality of life, overcrowding, lack of education, lack of awareness of illness. Thank you. Dr. Vasugi will explain about the pathophysiology.
அதை க்ளோஸ் பண்ணிடலாம்டா. அது ஓப்பன் பண்ணுங்க.
என்கிட்ட இதுவா?
ஃபர்ஸ்ட் லைட் பண்ணால் க்ளோஸ் ஆகிடும். பிபிடியில் இது ப்ரெசன்டேஷன் கிடையாது. நீங்கள் தான் ஸ்டார்ட் பண்ணுங்கள்.
Good evening, one and all present here. I am Dr. R. Vasugi, Department of Nodal. As a part of 100-day TB campaign program, I am here to present about the tuberculosis and its pathology and pathogenesis. Now, tuberculosis, it is an infectious granulomatous disease. It commonly affects lungs, but also affects intestine, meninges, bones, joints, lymph glands, skin, and other tissues of the body. It rarely affects the heart, skeletal muscles, pancreas, and thyroid. Now, the etiology is Mycobacterium tuberculosis, which is a rod-shaped, non-spore-forming acid-fast bacteria. The acid-fastness, which is due to the high mycolic acid content, and it has human strains, bovine strains, and atypical tuberculosis. And as we all know, it is an opportunistic infection, and it has opportunistic Mycobacterium tuberculosis, which occurs only in immunocompromised state. And coming to pathogenesis, the inhaled infectious droplets, it enters into the body via mouth and nose, and surprisingly, only 10% can reach the alveoli, and it enters into macrophages and phagocytosis. The macrophages, which is a type of white blood cells, which detects and destroying the
pathogens, and the phagocytosis, which is the key of immune mechanism which protects the body from the pathogens. And what is occurring in macrophages is the tubercle bacilli inhibits the maturation of phagosome and blocks the formation of phagolysosome, allowing the bacilli to replicate and protected the microcidal mechanism of lysosome. And it increased recruitment of macrophages from blood monocytes. As a part of immune response, the T and B cells are activated. The activated CD4 plus T cells develop the cell-mediated delay-type hypersensitivity reaction, while B cells results in formation of antibodies which play no role in body's defense against tubercle bacilli. And after 2 to 3 days, as a part of immune mechanism, the macrophages undergo structural changes which results in epithelial change and are called epithelial cells, and some macrophages form multinucleated giant cells. Around the mass of these cells, it forms the zone of lymphocytes, plasmacytes, and fibroblasts. The lesion at this stage is called hard tubercle due to absence of central necrosis. And within 10 to 14 days, the center of these cellular mass begins to undergo cacheation necrosis. And the causation, which is characterized by a cheesy appearance. The stage is called soft tubercle, which is a hallmark of tuberculous lesions. The development of causation necrosis is due to mycobacteria with activated T cells interaction, as well as by direct toxicity of microbacteria on macrophages. The soft tubercle, which is a fully developed granuloma, which causes the center, does not favor rapid proliferation of tubercle bacilli. And the pathology of active tuberculosis and pulmonary tuberculosis, which commonly affects the upper lobes of the lungs. And necrosis and cavitation occurs in pulmonary tuberculosis, and hemoptysis, which is coughing up blood. And the extrapulmonary tuberculosis, it can affect other organs also, such as lymph nodes, kidneys, bones, and meninges. Symptoms depend on the organ involved. And caseous necrosis, which is the cheese-like appearance, which is due to the accumulation of dead cells, which occurs in the center of granulomas. The sign of active infection is often seen in lung tissue and lymph nodes. And the types of tuberculosis is primary tuberculosis and secondary tuberculosis. The primary tuberculosis, which is not previously infected or immunized, which is also called Gord's complex or childhood tuberculosis. It most commonly involved in tissues like lungs and hilar lymph nodes, tonsils and cervical lymph nodes, small intestine and mesenteric lymph nodes. And the fate of primary tuberculosis is fibrosis, calcification
and ossification. The fibrosis is, it says as thickened and scarred tissue forming in the lungs, and the calcification is calcium deposits in the lung tissue, and the ossification is tissue formation in the lungs. And it is a progressive primary tuberculosis, primary miliary tuberculosis. And the secondary tuberculosis is the infection of an individual who has been previously infected or sensitized. It is also known as post-primary
or reinfection or chronic tuberculosis. It most commonly occurs in lungs. Other sites also involved, which are lymph nodes, tonsils, pharynx, larynx, small intestine and skin. And the fate of secondary tuberculosis is fibrous scarring and calcification, fibrous caseous tuberculosis, tuberculous caseous
pneumonia, miliary tuberculosis and tuberculous empyema. Thank you.
Diagnostic algorithm of tuberculosis. The signs and symptoms of active TB are fever, that is evening rise in temperature, night sweats, loss of appetite, chills, unintentional weight loss, fatigue, and cough up with blood, and productive prolonged cough that lasts for more than 3 weeks. Depending upon the types of tuberculosis, the symptoms may vary. The types of TB are active and latent. Active TB symptomatic இருக்கும், latentல asymptomatic இருக்கும். This is contagious and that one is non-contagious. In both active and latent TB, blood and skin tests are positive. Further, the active TB is classified into pulmonary and extrapulmonary TB. Pulmonary means which involves lungs, extrapulmonary other than lungs. The extrapulmonary is further divided into TB lymphadenitis, skeletal TB, miliary TB, genitourinary TB, liver TB, gastrointestinal tract TB, TB meningitis, TB peritonitis, TB pericarditis, and cutaneous TB. Based on the areas affected, the TB named. Further, the primary and reactivation of secondary TB, the clinical features may be asymptomatic or symptomatic in primary TB. Mostly secondary TB is symptomatic. Cough, fever, malaise is present in both the types. In chest X-ray, infiltration in the mid-zone of the lung is primary TB, that is in apex. The diagnosis features is based on the clinical diagnosis, bacteriological diagnosis, radiological diagnosis, additional criteria, diagnosis in special situation, confirmation of tuberculosis. There are some conventional diagnostic methods used. The rapid diagnostics in tuberculosis are expert MTP RIF and expert MTP RIF alta. These tests are used to detect TB and resistance to rifampicin. Rifampicin is a first-line TB drug. New diagnostic test, nucleic acid amplification test. 3 new classes used for detecting TB and resistance to isoniazid and second line anti-TB drug. Isoniazid is also first line treatment drug. Mantec test is a tuberculin test, old standard drug, old standard method to diagnose TB. It is a very simple procedure by injecting a PPD as a purified protein derivative intracutaneously. This will be accessed after 48 to 72 hours. The induration present on the skin, it will be more than 5 mm. Based on this, we will diagnose. This test may be false positive and false negative. False positive when atypical mycobacterium infection, previous BCG vaccination. False negative when weakened immune system, sarcoidosis, some viral infection, Hodgkin's lymphoma, recent tuberculosis infection, that is 8 to 12 weeks of exposure. Other investigations are molecular method, that is PCR, complete hemogram, shows lymphocytosis and raised ESR. This is the only bacteriological infection which shows lymphocytosis. Other bacteriological infections shows increased neutrophils. Radiological procedures also done. Example, chest X-ray. This chest X-ray shows Highland nodes and other parenchymal changes. AFP microscopy is another diagnostic method. In this method, 4 steps are followed. In this, the pink color appearance is positive, blue color is negative. If a patient came with clinical symptoms of TB with abnormality in X-ray, we have to do AFB smear. If whether AFB smear is positive or negative, we have to do NAT. If NAT is positive, whether in negative or positive smear, this is bacteriologically confirmed case of TB. If it is negative, we have to say that if culture is positive, bacteriologically confirmed case of TB. If culture is negative, it is bacteriologically or clinically diagnosed case of TB or consider other diagnosis. There are some tests which are used to detect yearly, that is within 1 hour and within 25 minutes we can get the result. This TB lamp assay is designed to detect the Mycobacterium tuberculosis directly from the sputum specimen, which provide result in less than 1 hour. But this test does not detect resistance to anti-TB drugs. Urine LM lamp, that is an lymphoarabinoma that is present in an active TB patients with HIV infections. This is an immunocapture assay based on the detection of mycobacterium. This is considered as an add-on test, but this is not considered as a confirmatory test. Low specific complexity automated NAT test for detection of resistance to NIH and second line anti-TB drugs is considered as a most recent diagnostic method. Further presentation will be continued by Dr. Tamil Bharati.